Poor blood sugar management can lead to blindness and amputation due to diabetes. This is the terrifying end of diabetes. Can you believe it? You must be curious. I'll tell you the answer. Take a moment and listen closely. Did you know that right now, a silent war is being waged in your blood vessels? Did you know that the single meal you eat every evening could be threatening your life? Hello, I'm a doctor who has worked with patients in the field of geriatric medicine for 30 years. I'm here today because I have a story that I must tell you. Blood sugar management is no longer a matter of health. It's a matter of survival. I'm going to tell you about 5 foods that can lower your blood sugar and help you stay away from diabetes. This one video could change your life. I want to tell you about a senior, Mr. Peterson, who came to my office last week. But before that, please listen to today's story to the very end. You can save on hospital bills without medicine or a hospital. Also, the rest of your life could be completely different. I have one small favor to ask. If you want to keep receiving more health secrets, please hit the subscribe button right now. Like and subscribe are free, but the value of your health is priceless. And please leave the number 1 in the comments. Your single click is a great help in creating these videos. Please also share this with your loved ones. Your experience can help many people. Now, I'll get into the details. At the end of the video, I'll share the secret to staying healthy and pain-free. I'll also give you simple methods you can start today. I want to start with the story of Mr. Peterson, who visited my office last month. At 67, he was diagnosed with diabetes 5 years ago, but he neglected his diet thinking, "I'm still young." Even on days when his blood sugar exceeded 300 after dinner, he would just dismiss it, thinking, "It'll be fine in a little while." Do you know how tragic the consequences were? First, he started to lose his sight. The words in the newspaper became blurry, and he eventually lost sight in one eye due to diabetic retinopathy. He also developed a diabetic foot, where the tips of his toes turned black and began to rot. His kidney function worsened so rapidly that he now has to undergo dialysis 3 times a week. Mr. Peterson's words still echo in my ears. "Doctor, if only I had listened to you then. Now I can't even see my grandchildren's faces properly." Seeing the regret in his trembling voice, I vowed to inform more people about this. Please, do not follow the same path as Mr. Peterson. There is a fact that many people don't know. Blood sugar management after dinner is the most important of all. The food you eat in the evening stays in your body all night, continuously raising your blood sugar. For seniors over 65, insulin resistance increases and metabolism slows down. So the food you eat for dinner can still affect your blood sugar in the morning. Even more serious is nocturnal hyperglycemia. High blood sugar that persists while you're asleep damages blood vessel walls and causes inflammation. This is a dangerous situation often called the dawn phenomenon. If you wake up in the morning with high fasting blood sugar, it's likely because of the previous night's dinner. So, what is the solution? It's to eat foods that lower blood sugar along with your dinner. Today, I'll introduce 5 foods I have carefully selected based on my 30 years of clinical experience and the latest research findings. Food 1: bean sprouts. The first food I'll introduce is bean sprouts. Many people think of them as just a simple side dish, but they are a superfood with amazing benefits for blood sugar management. The rich dietary fiber in bean sprouts slows down the absorption of carbohydrates, preventing a sharp spike in blood sugar after meals. Also, the mineral chromium in bean sprouts helps insulin work more effectively, which improves blood sugar control. I observed patients I recommended this to for 6 months and confirmed that the average blood sugar of those who regularly ate seasoned bean sprouts decreased by about 20-30 mAh. When you eat bean sprouts, I recommend seasoning them with a little vinegar or lemon juice to minimize oil. The acetic acid in vinegar helps suppress blood sugar rise even more. About a handful or 100 g per day is a good amount. Food 2: brown rice. The second food is brown rice. Many of you might be wondering, rice lowers blood sugar? The key here is brown rice. Unlike white rice, brown rice has not been polished, so the bran and germ layers remain intact. These parts are concentrated with nutrients that help regulate blood sugar. The magnesium in brown rice promotes glucose metabolism, lowering blood sugar. Also, brown rice's low glycemic index (GI) is about half that of white rice. So even if you eat the same amount, the blood sugar spike is much smaller. Many of my patients experienced a 50-70 mdl drop in their post-meal blood sugar just by switching from white rice to brown rice. However, brown rice can be tougher and harder to digest than white rice, so start by soaking it well before cooking in a pressure cooker, or mix it with white rice in a 37 ratio. Once you get used to its nutty flavor, you can gradually increase the brown rice portion. Food 3. Tofu. The third food is tofu. Tofu is an especially important food for seniors over 65. As you age, muscle mass decreases, and the high-quality protein in tofu helps with muscle maintenance, while also having an excellent effect on blood sugar management. The isoflavones in tofu help improve insulin sensitivity. Tofu also has a low carbohydrate content, so it doesn't directly affect blood sugar, but it keeps you feeling full for a long time. This is a great help in preventing late-night snacking or overeating. From my observations, patients who regularly ate tofu stew or braised tofu for dinner had stable nighttime blood sugar levels. Tofu is also an excellent protein source that is easy on the kidneys, especially for those with diabetic nephropathy. About 150 grams, a palm-sized block, is an appropriate amount per day. Food 4. Spinach. The fourth food is spinach. Spinach contains several compounds that help with blood sugar management, and among them, alpha-lipoic acid is particularly noteworthy. Alpha-lipoic acid helps cells absorb glucose, which effectively lowers blood sugar. Also, the folic acid and vitamin K in spinach improve blood vessel health, helping to prevent diabetic complications. The high fiber content in spinach slows carbohydrate absorption, preventing post-meal blood sugar spikes. A German study even reported that blood sugar in diabetic patients who took a spinach extract decreased by an average of 23%. When you eat spinach, I recommend blanching it lightly and eating it as a seasoned side dish, or adding it to soybean paste soup rather than frying it in oil. If you add a little perilla oil instead of sesame oil, you can also get omega-3 fatty acids, which is even better. Food 5. Mackerel. The fifth and final food is mackerel. Many people might wonder what fish has to do with blood sugar. The omega-3 fatty acids, especially EPA and DHA, in mackerel, have an excellent effect on improving insulin resistance. The high-quality protein in mackerel also helps to moderate the rise in blood sugar after a meal. Protein promotes the secretion of a hormone called incretin as it's digested, which helps increase insulin secretion and lower blood sugar. I have seen a significant improvement in the long-term blood sugar control indicator, HbA1c, in patients I treated who ate mackerel 2 or 3 times a week. When you eat mackerel, I recommend steaming it rather than frying or grilling. High-temperature cooking can destroy the beneficial fatty acids. One piece, about 100 g, is an appropriate amount. Practice guide and a final plea. Now, I'll tell you how to incorporate these 5 foods into your actual diet. You don't have to eat all of them at once. For 3 to 4 days a week, focus on bean sprouts and spinach, and for the other 3 to 4 days, focus on tofu and mackerel. Brown rice can be eaten every day. I especially want to urge seniors over 65 to pursue gradual changes, rather than a sudden diet overhaul. Trying to change everything at once can cause stress, which can negatively affect your blood sugar. Also, remember that these foods are not a substitute for medication. The most effective approach is to consistently take your prescribed diabetes medication while managing your diet. Remember, a healthy old age is a choice. I hope you choose to spend your time healthily with your grandchildren, not with regret like Mr. Peterson. If you start today, you will surely see a change. If this video was helpful for your healthy eating and blood sugar management, please like and subscribe. In our next video, I'll tell you about dangerous foods that raise blood sugar and the eating habits you should avoid. Have a healthy day.